Go.
Hi, I'm Emily. I'm a Northern student, and I'm going to be performing trach suctioning. Okay, so I'd come into the room, I'd wash my hands, I'd introduce myself, and I would check his armband against Amar, and he could also shake his head, name and birth date. I would put him in a high Fowler's position to do the suctioning. If he was comatose, he'd be in a lateral position. I have personal protective equipment that I won't be placing during the video, but so that I don't have any secretions that spill on me, and also a gown. The first thing I would do is do a respiratory assessment. I'd have him breathe in on 6 spots. I have him lean forward in 6 more spots. I would also check his respiratory rate and his pulse oximetry rate. I noticed that he has secretions in his lungs, which means that we need to perform a doctor's ordered trach suctioning. I'm going to put this over him to protect him from secretions. I'm going to check my suction machine, and it may be dirty, so this is protecting my hand. Turn it on, check the suction. That works. Throw that away. I'm now going to open my kit. There's a sterile dressing in here, or drape in here that I would pull out, minding the 1-inch border, putting the shiny side down. Then I would take the kit and put it in there. I have unopened normal saline that I would check. If it were open, it would have initials, date, and you have 24 hours to use it. Mine wasn't opened. Palming the label, I would pour it in. Now I'm going to put on my sterile gloves. The center is still sterile, so I can remove that. Now I can touch the stuff that's in the center for what I don't need. I'm just looking for the suctioning. And I'm going to use my left hand for the suctioning, because as soon as I touch the suction, it is considered, my hand is now considered unsterile, so it's connected. I look at his pulse oximetry, and It's low, so I want to hyperoxygenate him. So I will take his mask off, or his oxygen mask off, take the Anbu bag, connect to it 3 to 6 breaths at the same rate in which he breathes. 1, 2, 3, and then just holding the white part without my thumb down, and not touching any other parts of him. I will place the catheter until I meet resistance. Pull back a little bit, note the spot, and then when I'm pulling back out, turning no more than 10 to 15 seconds and not touching that end, putting his oxygen back on. I will give him time to catch his breath, and while I'm doing that, I will be noting the secretions that are in the tube, whether they're thick or thin, and the color of them, and then I will clear the line. I will then give him at least 30 seconds between each pass, and then we will go again if he still feels like he needs to be suctioned. And I will remove his mask again, re-oxygenate him at the same 3 to 6 breaths at his breath rate. 1, 2, 3, 4. Keeping the catheter sterile, I will go to my mark again without my thumb down, and then when coming back out, twisting. Re-put his mask back on. I will still note the color and amount that comes out. I will ask him again if he feels like he needs more suctioning, and he says that he does not. So I will, while I still have gloves on, I will remove his drape. I will throw that away. We are done with the sterile process. The inner glove. And I'll throw that away. I will then recheck him again. Check his oxygen, or his lung sounds in 6 quadrants. Have him move forward 6 spots. Check his oxygen rate, and it sounds as if the suctioning has helped. I would clean up my stuff and do my charting of how much came out, the consistency and color, and how well the patient tolerated the process. Thank you.